How are you? Especially good weekend?
Oh, it was amazing. Amazing weekend. I was in London with the kids at the Light Center, and yeah, the rest of the weekend was really nice. It was good fun. More relaxed with the kids, traveling and just going out and about, seeing the
Mm.
sights. So it was really, really nice. It was a good feeling, and I think
Did you travel on the train from
yes,
Milton Keynes?
yes. So it was on the train. So the tube going into London, and then the overground. So it was really, that's what I'm saying. It was the first time that I felt so relaxed, and also going with kids, it was even more relaxing. Because usually when we went, it was quite obviously we would think about COVID and be more cautious, wear our mask and maintain distance, which we were still doing. But because everyone was also more relaxed, I think it was so much
Yeah.
better. And I'm just thinking, if I felt like that, I'm sure everyone else is feeling like that as well.
Yeah, absolutely. I went to London as well, but I drove. I had to go and drop my daughter off at university, and then I went to Essex for a funeral. And I came back the
Oh,
next day.
sorry
Yeah, I
to
was
hear.
yesterday. Yeah, and then even at the funeral, people were keeping the distance. Chairs were arranged in such a way that there was some distance, and people were wearing masks. Not everybody was though, but
Yeah,
most people they were wearing their face masks.
yeah.
Dr. Freshman, I'm looking in the news now, telling us that ministers are going to meet later to decide whether or not to scrap mandatory COVID vaccinations for NHS staff in England.
Yes, so
And
that's the news that's
we
going
know
on.
yeah, this has been quite controversial from the beginning. That there's been arguments here and there by NHS staff who we know are hardworking. They're doing everything they can to help us get out of this COVID
Yeah.
non for the lack of a better word. And a lot of them don't, or some of them do not reach out.
Yes.
And of course, they have the right to refuse it. That's how I see it. And then we heard that they're going to make it mandatory in England that if you don't get a job by, I think, was it the 5th of February or something like that?
Second,
You get
second
your
or
first
third, second or third of February.
job.
So I think it was the second or third of February, Opoku. I think we're experiencing some technical difficulties today, everyone. Sorry about that. Hello, Poku.
On coffee break, we got the session back.
Yeah, I think there's some
Yes,
connection
Dr. Session, we got you.
issues. I'm really sorry. There might be some connection issues. I'm not sure what's going on. But yeah, go on, Opoku, about the mandatory vaccine. So that's still up for discussion today, isn't it?
Yeah, that's the main discussion today. The thing is, what I'm thinking is, some people will take it, some people don't want to take it for various reasons and other. Then they said we're going to make it mandatory for NHS stuff. You might lose your job, or you're going to lose your job if you don't get the job and all that. And people they kicked off against it. Some people.
Yeah.
The people who do not want the job kicked off against it. The NHS is stretched as it is.
Yeah.
And now we're going to sack nurses and doctors and NHS staff. What's going to happen to England? And I mean, I'm not surprised that Wales, Mark Drakeford said he'll take them. What's your take on?
Well, It's exactly what you said. So, on my opinion, as has always been and still stands, that we need to take the vaccines. Any person that is vulnerable, or even that any person
Yeah, but
might.
what if one doesn't? Yeah, what if one doesn't want to take it, Dr. Fisher?
Yeah. So if you don't want to take it and you're working on the front line, my advice would still be you need to take the vaccine. And I do believe that the vaccines has helped us. It's helped not only me, it's helped my colleagues, it's helped our patients, and it's helped family members and loved ones. It's helped everyone. So I still believe that we do need to take the vaccines. And also, I think if you're working in the front line, you have an extra duty to ensure that you are keeping yourself and also the vulnerable patients that we treat safe. So even people working on the front line, whether it's NHS staff or people in private, my view is still that you do need to consider to take the vaccines. It's great news if they're going to review it, because the headline says exclusive U-turn on mandatory COVID vaccines for NHS and social care workers. So obviously they're going to, Sajeev Javed sets to scrap the requirements after warnings that the jabs policies could lead to a shortage of 80,000 workers. So as you said, I think the reason why they're reviewing this is because they know that they're going to lose a lot of valuable NHS staff, which obviously is going to increase the burden on the NHS. And if we do not have enough staff, we will not be able to take care of our patients, and it's going to affect the NHS delivery of safe and effective care, where the ethos of the NHS and private is to keep the patient at the heart, at the center of everything, and ensure that we are ensuring them safe and effective delivery of care. So, I think it's a double whammy sort of thing, a situation, because as much as I think the government and the NHS believe that people need to take vaccinations, they don't want to lose their staff. So my advice still would be, and my opinion is that we do need to take the vaccinations. Whether you're working on the front line or not, irrespective, you do need to take it. And it's more important if you are working on the front line in terms of taking the vaccination, because you need to protect your patients. I can't understand how people, unless they have a valid medical exemption from vaccinations, I cannot understand how, moving on since 2019 December, since we started with the COVID-19 in Wuhan, China, since then, and now, January, we're almost nearing February 2022. So how can we justify not taking the vaccination if you are working on the front line? I can't understand it.
Dr. Feshni, that's your opinion, and
yes.
I personally also believe that people should get the vaccine and all that. But at the same time, let me also talk for the other side.
Yes, no, you must.
At the same time, it's entirely up to that person, and the school of thought is that people must not be penalized for making a decision or taking a decision, making a personal choice. Then again, the argument that taking the jabs will protect them and protect others, some people are rubbishing it because they're saying people have had the jabs, they've had the boosters, and they'll get COVID. In fact, some people, when they hadn't had the jab, they didn't ever contract it, but now they have the jabs, they have contracted the COVID. So they're saying the argument is that it doesn't necessarily make you COVID-free. We know there's scientific evidence that when you got the jabs, it makes it easier. It makes like even if you contract it, it's easier and all that. That's what we know. But at the same time, the argument on the other side is that if I don't want to take it, I shouldn't be penalized for it. I should be punished.
Yeah.
Because I don't want something to go in my body.
I understand that point, and it's good to speak for the others. As I've always said, it's about pro-choice. It's about pro-choice for us, whether we need to take the vaccine vaccinations and for our children. But personally, my personal opinion and my opinion as a doctor and a psychiatrist is that we do need to take the vaccinations. I actually reflected on conversations I had with my mom before she passed away in May 2020, and my mom had asked me about the vaccinations. And in that conversation, I told her, "Mom, I'm sure that if when the vaccinations come out, we will all need to take it, and it's going to keep us safe." And I reflected on that, and I thought, if my mom was here, I would tell her, the vaccinations have definitely helped us. It saved me, it saved my patients, it saved my family, my friends, and lots of people in the community. So I would still, up till now, I would say that we do need to take the vaccinations. And I think any person who thinks that we shouldn't take the vaccinations, they should have a really valid reason, or a medical exemption why they are not taking the vaccination, and especially healthcare workers.
What do you think about?
What is my?
Yeah, go on. Finish your sentence.
Yeah, no, I think we should.
No, you finish what you're saying, and then I'll ask you.
People on the front line, NHS or private, healthcare and social workers, you do need to take the vaccines. It's really important, and we have a duty of care to ensure patient safety.
Right. So what about the government's U-turn on the mandatory? Well, it's not been decided yet, but I can almost assure you that that's what's going to happen. They're going to say, all right, okay, guys, you don't really need it. I mean, it's not mandatory anymore. I don't know what else they're going to put in place
I know.
In other nations of the United Kingdom, it's not mandatory. For example, in Wales, it's not mandatory.
Yeah.
But
I know. I think if the government makes a U-turn, a lot of people will be very happy, which, I mean, it's great news for people that don't want to take the vaccine or can't take the vaccines. But my opinion would still be that even if the government does change its decision, and I think they will be basing that on losing NHS staff and the burden on the NHS. So I think that will be the primary reason. I don't think it would be a reason that they're making that change, that people don't need to have the vaccines because they think people don't need it, if that makes sense. I think the NHS and the government knows that people on the front line need to have the vaccines, but if they do change it, it will mean that it's not mandatory. I think we've lost connection with Opoku again.
Oh.
Hi.
Okay. Yeah, well, we're back again. I was just saying this. Really sick. Frontline agents must be fully vaccinated by the 1st of April, meaning they need a first dose by Thursday.
Yeah.
If they are not checked by April,
yes,
they will be deployed or dismissed. And around 77,000 have had no jab at all. Can you imagine if this number, 77, they still insist that they do not want to take the jab, and we lose 77,000 health workers? What's that going to happen to? Is it like from frying pan to fire, or because if it's like 77,000 NHS workers or health workers, we're doomed. The NHS is stretched already.
Definitely. So I think that was my understanding, was that Sajid Javid and the government, Downing Street, and whoever needs to make that decision today, if that becomes final, is that they will make that decision based not that people don't need the vaccinations, that NHS staff don't need it, but based on the fact that the NHS will be at a crisis point if they lose about 80,000 of its staff. Because we already, as you said, in all healthcare sectors, private and NHS, people are finding it difficult because of the COVID-19. So there is obviously a shortage of NHS staff. So it'll be interesting to see what the decision is going to be, Opoku. But as I said, I've always been pro-choice. I do understand the point, but I think that people do need to take the vaccination. I would still stick by my decision. As I said, the journey we've had about vaccinations, there is enough evidence. I understand that people have obviously taken the vaccination. It doesn't provide 100% effectiveness against catching COVID-19, and people have got it. But I think it's reduced the mortality rate. So it definitely has reduced the mortality and morbidity when people have got the COVID-19. So if people had been vaccinated and got contracted COVID-19, the symptoms might not
One
have
of the
been.
questions people are asking is, if I take the jab and I take,
Hi, Opoku. I think there seems to be a lot of connection issues. I'm not sure where it's coming from. Sorry about that.
I won't blame coming from. It just keeps going off, and then it comes back. But hey, let's make do with what we have.
Yeah.
That's what we can do, really.
So you were asking a question that you have received a lot of questions on, or queries.
No, what I'm saying is a lot of people are asking that, anti-vaxxers. People are saying that, right, what's the point in getting the jabs if there is no guarantee that it's going to prevent me from getting COVID?
And that's a valid question. That is valid. That is a valid question to ask. So I do understand that point. But as I'm saying, the evidence is there that it's helped us. Even though there's no guarantee, we cannot, no one, not even the scientists and the people that have produced the vaccines can give us 100% assurance that by taking the vaccinations, you will not get COVID-19. But what the evidence does suggest, and ongoing evidence will suggest, is that it helps reduce the morbidity and mortality of COVID-19. And it has definitely helped in terms of reducing the numbers, reduced in terms of hospitalizations and people going into ICU and requiring a ventilator. So, and also the spread of COVID-19, because the more people that have been vaccinated, it's helped us provide better protection. And then not just for ourselves, but for other people. Because if we are vaccinated and we have a lesser chance of getting COVID-19, then we will be helping other people around us who are more vulnerable, where we could potentially spread the COVID-19. So it's definitely just not saying, oh, it's not 100% effective. We need to look at the positives and the benefits of having had the vaccinations, the first, the second, and then the boosters, and then maybe the fourth vaccine that's going to come into effect at some point. It has definitely helped not just the UK, but people globally.
Okay, but surely you'll understand why there's a lot of pressure on the government to make a U-turn on this mandatory rule. It's clear on the screen that the government has been under pressure from some within the health service to scrap the mandate, arguing that it would lead to a staffing crisis. And that is very true. It would lead to staffing crisis. Now, likewise, warned that a catastrophic impact on maternity services, while the Royal College of GPs and Royal College of Nursing called for the deadline to be delayed. Okay? But the Department of Health and Social Care has previously insisted the policy was the right thing to do to protect patients. The UK Health Security Agency says vaccines are proven to be effective against hospitalization, mortality, infection, and transmission. We do agree with that because it's been scientifically proven that the vaccine does help.
Yes. That's correct.
But I think the main thing that people are what is staffing?
That's the main thing, and that's why they would change their decision. But I think even if they make that decision, Opoku, I think the government will still be under scrutiny for making that decision.
Yeah, we're going again.
Yeah, I was saying that if Sajid Javid and his team, 10 Downing Street, they make that decision, it's going to receive a lot of scrutiny. And as you said, it's very, very controversial from the beginning. We've gone again. So we just lost Opoku again. So I'm not sure if he's coming back on. But I do apologize, everyone, for the difficulties that we are posing today in terms of the technical issues. But it was an interesting discussion about the vaccinations and about mandatory vaccinations and possibility that the government, Sajid Javid and his team, might make a U-turn on that decision, so that they might make it that it's not mandatory. So it's a very controversial issue. I still have my viewpoint. As I said, everyone needs to take the vaccine, and especially if you work on the front line, it's really important to protect our vulnerable patients and yourself as well, and your loved ones and your family. So we'll wait to hear an update later on today, whether a decision has been made. But obviously, if that decision is made that vaccines will no longer be mandatory, it's obviously a lot of people that haven't taken the vaccines and the anti-vaxxers will obviously be very, very pleased about it. So I think I'm going to end this broadcast because I think Opoku's the connection is totally lost now. But stay safe, everyone, and have a fantastic day. And hopefully we'll update you more on this later on in the day. Thank you very much, and namaste, everyone.